Getting sick in medieval times wasn't like calling your doctor and picking up antibiotics at the pharmacy. There were no appointments, no insurance claims, and a single misdiagnosis didn't mean trying a different medication, but possibly having leeches attached to your face while a barber cut holes in your skull. Patients learned this the hard way, usually right after someone confidently declared, "Don't worry, bleeding out a few pints should fix that headache." Medieval doctors were the original medical professionals, and they weren't just concerned about whether you'd survive. When it came to treating illness, getting it wrong meant you might end up worse than when you started, possibly missing a limb, or convinced that the position of Saturn was responsible for your stomachache. It's like going to the emergency room today, except the doctor might prescribe prayer, a good bleeding, and a diet of crushed pearls. No pressure. Understanding what made you sick was the first challenge, and medieval doctors had some truly creative theories. They believed in something called the four humors: blood, phlegm, yellow bile, and black bile. According to this system, all illness came from having too much, or too little, of one of these bodily fluids. It's like thinking your car problems are always because you have too much or too little windshield wiper fluid. Sure, it's a fluid in your car, but that's probably not why your engine won't start. Historical medical texts show that doctors would diagnose illnesses by checking a patient's pulse, looking at their tongue, and most importantly, examining their urine. And I mean really examining it. They'd check the color, smell it, sometimes even taste it. One medical manual from the 1300s includes a chart with 20 different urine colors, each indicating a different illness. Imagine being the artist commissioned to paint that chart. So, for this one, I need you to capture the essence of dark amber with greenish tints. The urine obsession got so intense that doctors would carry special flasks just for urine samples. These flasks, called machulas, became the symbol of the medical profession. That's right, before the caduceus, the symbol of medicine was basically a fancy pee jar. Some doctors got so famous for their urine reading skills that they'd diagnose patients without even meeting them. Just send over a sample and wait for your prescription. Medieval telemedicine was apparently all about the bodily fluids. Temperature was a big deal in medieval diagnosis too. But they didn't have thermometers, so doctors would just feel your forehead and make educated guesses. One medical text instructs doctors to compare the patient's temperature to a healthy person, a stone from a river, or fresh bread. Because nothing says precision medicine like comparing someone's fever to a baguette. Bloodletting was the medieval medical system's answer to basically everything. Headache? Bleed it out. Broken leg? Better bleed just to be safe. Depression? Definitely need a good bleeding. Studies of medieval medical records show that bloodletting was prescribed for over 90% of conditions. It's like how IT support always tells you to turn it off and turn it back on, except instead of rebooting your computer, they're draining your blood supply. The amount of blood they'd take was shocking. Doctors would drain anywhere from a few ounces to several pints, depending on how serious they thought the problem was. One medical manual recommends bleeding a patient until they faint as a sign you've removed enough bad blood. Medieval medical success was measured in patient unconsciousness. Talk about low bars for treatment outcomes. They had several creative methods for bloodletting too. The most straightforward was venesection, just cutting open a vein and letting it flow. Doctors had charts showing which veins to cut for different ailments. Headache? Cut the vein in your temple. Liver problems? Go for the one in your foot. It was like a twisted medical connect-the-dots game where all the dots led to blood loss. But the real stars of bloodletting were the leeches. These weren't just any leeches either. Medieval doctors bred special medical leeches, carefully maintained in jars of water. A good medical leech could remove about half an ounce of blood per session, and doctors would use dozens at a time. Archaeological evidence from one medieval hospital shows they went through over 50,000 leeches per year. That's a lot of slimy medical assistance. Leeches actually had some advantages over cutting veins. They released natural anesthetics, so patients felt less pain. Plus, they were reusable. Wash them off, let them rest, and they're ready for the next patient. Though I'm guessing previously used medical leech wasn't a selling point patients were excited about. One medieval writer praised leeches as God's own little surgeons, which really makes you wonder about his definition of divine intervention. The leech application process was surprisingly sophisticated. Doctors would clean the patient's skin, sometimes rubbing it with blood or milk to attract the leeches. Yes, you read that right. They'd put blood on you to encourage the leeches to drink your blood. Medieval logic was something special. Once attached, leeches could stay on for hours, slowly swelling up like tiny blood balloons. Removing them required skill because yanking them off could leave their teeth embedded in the skin. Medieval aftercare was delightful. Some conditions required more aggressive approaches, which brings us to one of medieval medicine's most terrifying procedures, trepanation. This is the fancy medical term for drilling holes in someone's skull. And yes, they did this while patients were awake. Archaeological evidence shows that trepanation was surprisingly common, with some medieval cemeteries containing up to 5% of skulls showing trepanation holes. That's 1 in 20 people walking around with ventilated heads. The reasons for trepanation were varied and creative. Severe headaches? Drill a hole to let the bad spirits out. Epilepsy? Make a window in the skull for better air circulation. Mental illness? Obviously there's too much pressure in there. Time to release it. One medieval manual suggests trepanation for excessive thoughts, which sounds like something that would cure any condition by making you think about nothing except the drill in your skull. The survival rate was better than you'd expect, though. Studies of trepanned skulls show that about 50% of patients survive the procedure. We know this because the bone shows signs of healing around the holes. Some people even underwent multiple trepanations throughout their lives. One skull found in France had 7 different holes, suggesting this person either had really persistent headaches or really trusted their doctor, or possibly had no other choice. The tools for trepanation were basically carpentry equipment. Doctors used drills, saws, and scrapers designed for working with wood. They'd make a circular cut, carefully removing a disc of bone about the size of a coin. The trick was stopping before you hit the brain. Medical texts warned doctors to look for a dew of blood, indicating they'd gone deep enough. Medieval precision medicine meant watching for the brain sweat. Now let's talk about surgery, because cutting into people was considered a lesser form of medicine. In fact, many surgeons weren't even doctors, they were barbers. That's right, the same person who cut your hair would also amputate your leg. The red and white barber pole we still see today actually represents blood and bandages. Next time you're getting a trim, remember, you're sitting in a chair with a surprisingly violent history. Barber surgeons handled everything from pulling teeth to removing tumors. They traveled from town to town, setting up shop in markets and announcing their services. Think of them as medieval food trucks, except instead of tacos, they're offering emergency surgery. Records show some barber surgeons became quite famous, drawing crowds to watch them work. Medieval surgery was apparently a spectator sport. Amputations were common procedures, usually done to save patients from gangrenous limbs. The technique was brutally simple. Tie a tourniquet above the infected area, cut through the flesh with a large knife, saw through the bone, then cauterize the wound with a hot iron. The entire procedure took about 15 minutes if the surgeon was skilled. Speed was crucial because, remember, no anesthesia. One account describes a surgeon who could amputate a leg in under 3 minutes. His nickname was Lightning Jack, which sounds cool until you remember what he was doing quickly. Pain management during surgery was primitive at best. Some doctors used a mixture called duale, made from ingredients like hemlock, opium, and henbane. This mixture could knock patients out, but dosing was tricky. Too little and they'd be screaming, too much and they'd never wake up. Many surgeons preferred patients stay conscious, arguing it helped them work faster when patients screamed at them to hurry up. Medieval motivational techniques were effective, if disturbing. Wound care after surgery was where things got really interesting. Doctors believed that wounds needed to produce pus to heal properly. They called it laudable pus, and would actually try to encourage infection. They'd pack wounds with substances to irritate them, ensuring nice, infected, pus-filled healing. Modern medicine has since determined this is absolutely the wrong approach, but medieval doctors were very committed to their pus theories. Some surgeons developed surprisingly advanced techniques, though. They could set broken bones, remove bladder stones, and even perform early forms of plastic surgery. One famous surgeon could reconstruct noses lost to disease or battle using skin from the patient's arm. The procedure took weeks and required keeping the arm attached to the face while the skin grafted. Imagine explaining that situation to your medieval neighbors. Infection was the biggest killer after surgery. Not that medieval doctors understood why. They'd use the same unwashed instruments on multiple patients, never thinking to clean between procedures. One surgical kit from the 1400s was analyzed and found to contain remains of blood from at least 12 different people. It was less a medical tool and more a disease distribution system. Medieval cross-contamination was an art form. Medicines were a whole other adventure in medieval healthcare. Forget pills from the pharmacy. Medieval prescriptions read like recipes from a witch's cookbook. Common ingredients included powdered gems, ground-up animal parts, exotic herbs, and occasionally things that were definitely poisonous. One popular remedy for various ailments was called theriac, a mixture containing up to 70 different ingredients, including viper flesh, opium, and honey. Making it took months, and pharmacists would hold public ceremonies for mixing new batches. Medieval medicine was nothing if not theatrical. The complexity of some medicines was absurd. One prescription for a headache cure required ingredients from 3 different continents, needed to be mixed during a specific moon phase, and had to be stirred exactly 100 times clockwise. If it didn't work, clearly you'd stirred wrong. The price for these elaborate medicines could bankrupt a peasant family. One wealthy merchant's account book shows he spent more on medicines in 1 year than his servants earned in salary. Medieval healthcare costs were apparently just as outrageous as today. Animal-based medicines were particularly popular. Doctors prescribed ground unicorn horn for poison, except it was actually narwhal tusk and did nothing. Powdered mummy was used for everything from headaches to broken bones. Yes, actual ground-up Egyptian mummies. The demand was so high that suppliers started making fake mummies from recently deceased criminals. Medieval pharmaceutical fraud was disturbingly creative. Some prescriptions were oddly specific. For baldness, one remedy called for burning bees, mixing their ash with mouse droppings and applying it to the scalp. For poor eyesight, doctors recommended rubbing your eyes with a mixture of bat blood and ant eggs. One has to wonder who first tried these recipes and what their thought process was. You know what this eye problem needs? More bat blood. Herbal remedies were more legitimate, and some actually worked. Willow bark contains the compound that became aspirin. Foxglove, though dangerous, helped with heart conditions. Opium poppy was correctly used for pain relief. The problem was that medieval doctors also used these alongside the ground mummies and powdered gems, so figuring out what actually helped was nearly impossible. It was like trying to find a needle in a haystack made of medical nonsense. The doctrine of signatures added another layer of weirdness. This theory held that God marked plants to show what they could cure. Walnuts, which look like brains, must be good for brain problems. Yellow flowers must cure jaundice. Spotted plants cure skin conditions. It was medical treatment based entirely on visual puns. One doctor reportedly tried treating hair loss with fuzzy plants because they were hairy. The patient remained bald but presumably had nice-smelling skin. Religious healing played a huge role too. Many people believed that illness was divine punishment for sin, so the cure was prayer and penance. Pilgrimages to saints' shrines were considered medical treatment. Some shrines specialized in specific conditions, one for blindness, another for infertility, another for possessed pigs. Yes, there were saints you prayed to for your livestock's mental health. Medieval healthcare was comprehensive, if nothing else. Relics were huge in medical treatment. A splinter from the true cross, water that touched a saint's bones, cloth that wiped a martyr's tomb, all were believed to have healing powers. The trade in medical relics was enormous. Some cathedrals had entire collections, basically medieval medicine cabinets filled with holy body parts. One church claimed to have enough pieces of the true cross to build an entire forest, leading skeptics to joke that Jesus must have been crucified on a remarkably large tree. Hospitals existed but weren't quite what we'd recognize today. They were more like hotels for sick people, where monks provided care and prayers. Medical treatment was secondary to spiritual care. Archaeological studies of medieval hospital layouts show they were designed so patients could see the church altar from their beds. The theory was that viewing holy items helped healing. Some hospitals had better survival rates than others, probably because they also provided food and warmth, not because of the altar views. These hospitals could be surprisingly large. Some accommodated over 100 patients, all in one giant hall. Privacy wasn't a concept. Everyone's medical problems were public knowledge. One visitor's account describes a hospital where patients were packed so tightly that diseases spread like gossip at a wedding. Medieval infection control was non-existent. Doctors' training was elaborate, but often disconnected from reality. Medical students at universities spent years studying ancient texts by Greek and Roman physicians, memorizing theories about humors, and reading detailed descriptions of treatments. But actual hands-on practice was limited. Dissecting human bodies was rarely allowed. So doctors learned anatomy from pigs and dogs, then hoped humans were similar enough. Spoiler alert, they're not identical. The licensing process varied by region. Some places required passing examinations before practicing. Others just needed you to claim you were a doctor and people would believe you. This led to plenty of quacks setting up shop. One famous case involved a man who practiced medicine for 20 years before someone discovered he couldn't read. He'd been making up treatments based on the pictures in medical books. Surprisingly, his survival rate wasn't worse than licensed doctors. Women faced particular challenges in medieval healthcare. Male doctors weren't supposed to examine female patients too closely due to modesty rules. This led to women's health being particularly neglected. Childbirth was handled entirely by midwives, who learned through apprenticeship and had their own body of knowledge passed down through generations. Some historians argue midwives had better practical knowledge than university-trained doctors, especially since their treatments didn't involve bleeding or skull drilling. When it came to childbirth, medieval medicine offered prayers, herbal remedies, and hope. Maternal mortality was staggeringly high. Records suggest between 1% to 2% of births resulted in the mother's death, and with women having many children, lifetime risk was significant. Midwives tried everything to help, from special birthing chairs to herbal concoctions to charms and prayers. Some methods helped, some didn't, and some probably made things worse. But they did their best with the knowledge available. Despite all the bloodletting, skull drilling, and questionable medicines, some medieval patients actually got better. Sometimes, this was despite treatment, rather than because of it. The human body is remarkably resilient. Young, healthy people could survive blood loss, infections, and even amateur brain surgery. Medieval medicine's success rate was less about the treatments and more about human survival instincts being stronger than medical incompetence. Looking back, it's easy to mock medieval medicine. But these doctors were working with the best knowledge available to them. They made careful observations, tried to help their patients, and slowly built the foundation for modern medicine. Some of their herbs became real medicines. Their surgical techniques evolved into modern procedures. Even the terrible ideas taught us what not to do. Every medical advance started with someone trying something new, even if that something was leeches. So next time you're annoyed about waiting at the doctor's office or paying a high copay, remember, at least they're not suggesting bloodletting, prescribing ground mummy, or offering to drill ventilation holes in your skull. Medieval medicine was many things. Effective wasn't usually one of them. But it was definitely memorable. especially if you survived it.